this is the fullest I've seen it for a while. Cool. Hi. You don't have to call me Dr. Terry. I know I'm a doctor, so I don't take it personally. So I want to talk a little bit, having done medical schools and taught medical students. It's a very rigorous training, and it does have the most common things. The doctors kind of call, like, oh, if somebody walks in your room and they have these symptoms, what's the top diagnoses? This is how they test them, okay? And the hard part is, though, the list usually is really, really short because they don't know all the things on the list and haven't been taught all the things on the list, but they talk about like the top 3. What is one of the phrases doctors use is, okay, if you're in the United States, it may be a horse. But if you're in Africa, it may be a zebra. So part of what we're going to talk about is what they're claiming are zebras or they're not acknowledging at all are an issue. And kind of those zebra categories so that after they've done their usual thing and they say, well, I don't think there's anything I can do to help you. This is too complex for me. You can at least bring up some stuff, and if they have no idea or no clue, have nothing to offer you, you need to find a different doctor. It's just that important because the chances are very high they'll try to patch things on and give you medicines and give you some other things, but they don't really know the whole big picture of the other potential things it could be. And what we're seeing more and more is they do really great with those major diagnoses. They test them on all of those, but they don't test them on multi-system diseases that actually go across the board. So anybody have an idea what a multi-system disease might be called? One that one of your friends has, or that you always wondered if you had, or that the doctor looked at you and went, Anybody? Lyme disease is one of those, yes. What else? Any other ones? And Lyme disease has co-infections. Anybody know the name of the co-infections? Babesia, Bartonella, erligosis. We're finding more and more mycoplasma as well. And a lot of those are also associated with certain places in our U.S. in location with, but the other thing that they'll say is if you bring up something and they say, oh, well, that isn't carried by ticks, what we're finding is because we're moving into all the areas where the wildlife are, mosquitoes carry it, beetles carry it. You know those little black and with the red borders around them? They're actually very well known for causing Chagas disease. But it's from Brazil because they're from Brazil originally. The kissing bugs, yeah, the kissing bugs you see around here. We used to not have any of those, and we now have a lot of those. And they can bite, yes, and they usually have something inside of them, like a tick. And we have a lot of them around here.
I was bit 25 years ago, northeast of here, by one.
Yes, now there's ways we could check to see if you have any of the kinds of things they would carry. But to be honest, they don't know anything about those. Sometimes they don't even know the name of those bugs. So you try to describe it to them, and it's like, oh no, none of those things ever give any processes. We're finding also that if you've had spider bites, you can get activated. If you have they say, oh, if it's a little nymph, it can't carry anything. That's not true. Oh, it didn't attach long enough. That's not true. So part of the process of it, and I'll start with the controversy first about Lyme, but then we'll talk about some of these other issues that they should delve into and look at. And if they can't figure out what else to do, then you need to find another doctor. So when we first discovered, and there's lots of controversy on whether it escaped from a bacterial place on an island on the East Coast or not, but it is worldwide. They actually have different varieties in all the countries around the world. The infectious disease population said, oh my God, we're going to have to give so many antibiotics, and this is going to be too expensive on our health system, and oh no, we're not sure we really believe this, and oh yeah, it has to stay in 24 hours. All of these things that are myth So even infectious disease people oftentimes don't learn about Lyme. But one of the things about Lyme, what closest other disease that we had kind of a scam around is kind of like Lyme? Any ideas? Syphilis, Tuskegee, where they were essentially having a whole bunch of black men that they did not treat even after they figured out what to treat them with. They wanted to know what it would do to the body in its end stages. And that was one of the big impetuses in HIV, because part of the problem was they weren't doing drugs to take care of it fast enough. There are all of these different rules on how to do that. And so in the US, we were one of the worst. That's why there were all of those, not riots, but protests, especially in San Francisco, where there was a huge gay population. So with that, like monkeypox as we're having now, and some of the other ones we're seeing, the bottom line is it's a spirochete and it has 3 stages in Lyme specifically. It bites you, it may have an EM rash or not. The statistics are anywhere from 0 to 25, in some places say 53. But it doesn't have to have an EM rash and it still may carry Lyme. Okay, so just because you didn't get a bullseye rash doesn't mean you may not have Lyme. It's carried in utero. If your mom had Lyme and was bit by ticks, they can pass it to the babies. People that actually are pregnant, we give antibiotics and different treatments to them while they're just like an HIV, so they don't give it to the fetus. And they present a little different and they're a little harder to diagnose, but they still have Lyme. Okay? The second stage is kind of an inert stage where it's not as active. In terms of being not as active, it hides in places. Anybody know where it hides? Central nervous system. So like syphilis, it hit the central nervous system, so they can get seizures, they get encephalitis, they can get pretty quick dementia or delirium or different processes with their brains. And so with that, then in the inert phase, then you can see that encephalitis in the acute when you've just been bitten, or you can actually see it in the inert phase, but not as often. And then the chronic phase, all of that stuff comes back even worse. And it's even harder to treat in that process. What you have to do with a encephalitis is you have to give them 21 days of ceftriaxone, like they have meningitis, because it is a meningitis in that process. So with that whole process, that's Lyme, and it likes to live in cartilage areas as well. So it's joints that kind of keep wandering around. Oh, it's this right knee this time, and then, oh, that's fine, and now it's the left knee, and oh, now it's going to the shoulder. It's rotating processes of having the different joints activated because it loves cartilage, and it loves the CNS, is the most valuable thing. So with Bartonella, one other thing is somebody suddenly starts and gets Bell's palsy. They think they had a stroke. It may not be a stroke and can be Lyme's. So Bell's palsy, TMJ, spine pain, all of that are symptoms of Lyme. Babesia is more like malaria. Malaria is a relapsing disease that you're fine for a while and then you have sweats, fevers, chills. It's what everybody struggles with in all these other countries, and we pretend we don't have it. Do you know why gin and tonics have quinine in them? Because it treats malaria. So all the British were hanging out in the aisles with their gin and tonics with quinine in them. That's why when you buy quinine or the water here, and it's from Pakistan and India, it all has quinine in it. They discontinued making it as a med. What does quinine help treat? Leg cramps, restless leg syndrome. They don't even make the pills anymore. So with those, there's been a progression of these kind of diseases that are part of that process. You get chills, dizziness, woozy, sound sensitivity, headaches, band-like migraines, shortness of breath, but your lungs are fine. So like you used to go up that hill every day when you did your walk, it becomes torture. You just can't catch your breath. It lives in the red blood cells like malaria. So it makes them not carry as much oxygen, like malaria. So it's very similar in that way. You get air hunger, tingling in the hands, brain fog, it happens with everything, anxiety, panic attacks, easy overwhelm. Bartonella is associated with an animal that a lot of us have in our house. Any idea what it's associated with? Cat scratch fever. Cat scratch fever, yeah. So you get lymph nodes. It often has emotional swings too, where suddenly you get really, really angry when it's like, why am I getting so angry about this thing? And up and down emotional things. You get GI symptoms because it likes to live in the gut. You look at your body and you were looking fine, and you suddenly looked in the mirror and you had all these kind of, they looked like little scars, not going in the stretchy way, but doing across planes. It's symbolic because it gets in the skin. So Bartonella has a very distinctive rash pattern, like its scars, like its stretch marks. But it's very distinctive, and it's not in the normal stretch mark areas. Okay? You get really painful feet, especially in the morning. What else does everybody go to the doctor for, and they say, oh, I have really painful feet. What's the first thing they're going to tell you? Diabetes or neuropathy or plantar fasciitis. Can it be Bartonella? It can be Bartonella. If none of the drugs are working, Bartonella is a bug. It's a insect, or I'm just going to call them bugs because there's parasites, there's all these different things that go along with all of that. One last thing is on syphilis, it also makes cyst forms. So it doesn't totally go away and hides out in a cyst, and then it can reactivate. So that makes it really hard to know, I was having this for a while, and then everything got quiet, I didn't really have anything, and I'm having all those symptoms I had when I was 20, when I got covered with all those ticks, or whatever. Just be aware that it doesn't go away easy in that process. Anxiety attacks for Bartonella, migratory pain, depression, cystitis. For women, they go, oh yeah, I just have another UTI. It actually makes your bladder inflamed, feels like you have an infection, but you often don't have an infection. And they go, oh, we don't know what this is. No, we're not going to give you any antibiotics. Could be Bartonella. Ehrlich is pain in the shoulders and then and the hips down. Mold. I'm going to talk a little bit about mold. But one of the things we've now realized is because we don't get that cold here and often don't get snow or have it be cold enough to freeze things, we have a lot of issues with mold. There was a leak in the house. There's a leak or water under the floor. We're living in an old trailer. We were living in the old barn. We feed our horse with hay that has mold in it. It's a very common problem, but all of the Lyme ones mostly have Herxing cycles, and I'll explain that. So syphilis has a Herxing cycle, but so does Lyme. Every month or 2 months, suddenly you have this onset of symptoms, and then it goes away. Oh, 2 months more. You get the same amount of symptoms and it goes away. Why do you think you'd have kind of that cycle? They're laying babies. They're laying babies. They're giving you more spirochetes. They're coming out of the cyst phase. It's like parasites. Have a cycle too. They're about a month cycle. Bartonella is about 3-week cycle. Babesia is about every 2-week cycle. So, and that's what happens with malaria too. You keep getting malaria cycles that come and then may disappear for a while and then come back, where you have those same kind of processes. But they think, oh, that's only in China. That's only in China or Africa or wherever. And this isn't everywhere in the world. Okay? So we're going to try to distinguish a little between those symptoms and mold. What about mold? Do you think it has a cycle? Probably, but what do you think it would be?
With spores releasing.
Spores releasing. So yeah, going into a new place that has spores. You open up your mom's old house, she just died. All the spores are in there, and suddenly it's like, oh my God, I don't feel good. I'm sneezing, I can't breathe. Very common, people with mold also develop allergies for mold. So guess what drug they usually can't take? Penicillin. They get allergic to penicillin. It's a mold. It's made from a mold in that process. I'm going to do one other kind of weird symptom. What if suddenly I'm a big meat eater and I just get sick? I throw up. I can't keep meat down. I have to change my diet totally around to being vegetarian.
Alpha G and the ticks.
Alpha-gal is one of the newest things because ticks eat off of animals that are meat. And so they have an allergy that they pass on. And if you're bitten by a tick that has alpha-gal, they thought it was just one kind in Texas, but it's not. But if suddenly your kid can't eat meat without throwing up, without getting sick, you want to check and see if they have alpha-gal, because that could be showing you that there's some tick bite or something that he contacted that had that antibody in it, and now he has that antibody.
So you have to specify that you want that pest.
That's correct.
And there used to only be specialty labs that you can deal with it with a test.
And they're better about that. They're better about that. But to be honest, is the doc going to not know sometimes how to order it? Yeah. If he's never done it before, it's going to be kind of a new thing. You'll be more knowledgeable than he is, or her. It's not just men. Okay, so many illnesses are spreading in the same symptoms. Our environment is changing. We're now talking about heavy metals. We're now talking about all the chemicals and plastics and different types of things that we've made things into that they're forever chemicals. The heavy metal toxicities, our pipes are old. We're getting lead toxicities again, like they did up in Michigan. There's a lot of things going on now in terms of that there's plastic in everything in our world, and we pretend it's not there. Mold is often more in the wintertime when it's wet and damp, but it doesn't mean it goes away. But usually the biggest flares are in the winter, or the rainy season, I would say, for here. It causes stress problems, sleep problems, all of these. So it's a multi-system body look at what's going on. What if your kid was okay and suddenly they're having all of these problems, and then you finally kind of ask them a lot of questions, or it's your grandkid, or it's you, and you fell off a bike, you fell off a motorcycle, you fell off whatever. Brain injuries cause some of these symptoms too. Brain fog, cognitive stuff, you can't pull out words of things you used to know. Yes, could it all be blamed on, I'm getting older, but is it always I'm getting older? No, it's not. So there's a swelling around the brain when you have those. There's a swelling around the brain when you have a stroke as well. So, or even a little TIA. There's swelling around the brain, and you can have some of these symptoms. So you got to take a broader look and go, okay, there's got to be more things on this list that I need to look at. Oh, that happened to me when I went skiing. I wasn't wearing a helmet. I fell down the mountain. I was on my motorcycle. I was on my bike. I fell down and hit my head. I was at my kid's football or soccer match, and somebody came off the sidelines and knocked me over and hit me in the head. Kind of start broadening those things. And the most misdiagnosed or non-diagnosed is thyroid issues. I want to mention too, because most doctors do not know how to actually check the full thyroid. And if you get Hashimoto's, if they don't check all of the antibodies for thyroid, you may never find that, and it turns your heart into mush. It turns your heart into mush. It gives you dilated cardiomyopathy, all of these things, because the thyroid is kind of one of the main hormones that deal with your adrenal glands, that deal with your kidneys, that deal with your pituitary. All of these match, and even TBIs totally mess up all your hormones and all of that axis as well. So these are multi-system kind of processes. Okay, and only 25% of people ever remember that they've ever been bitten by a bug at all. It also happens with rattlesnakes and scorpions too, by the way. It activates an inflammatory cascade. So luckily we don't have much around here, but we do have snakes. What's the most common thing that everybody complains about is fatigue. It's a very general symptom. You need to check all of these things when you're looking for a fatigue diagnosis. You have to check the thyroid wipe. You need to check and see, oh, well, I had COVID. You can look at a COVID person and suddenly you notice that they have Epstein-Barr that's been there. They have, so they had mono maybe as a kid. It's been reactivated, CMV, herpes 1, herpes 2, herpes 6. Oftentimes you look at their labs and all of these things have massive antibodies. It's like the body's frantically trying to put something down. But they've been reactivated, and COVID definitely did that for a lot of people. And it takes a lot of energy to make all those antibodies. But it's on alert. It's ready. It's wanting to know what's going on. Mycoplasma is another one because mycoplasma actually is a common pneumonia. But anybody know what we noticed for the first time when our guys went off to Iraq and Iran? Gulf War syndrome was mycoplasma. It was a mycoplasma that was very specific to the desert. And so I know the guy who did all the labs for the military, and he announced it to everybody he knew. But of course, do most of the doctors know that? No. Mycoplasma can make you look like you have cancer, and you don't. It eats you up from the inside. It's really, suddenly it's like you're losing weight. They check your gut. They check you for cancer of every kind, your lungs, everything else. That's not it. So they need to check for mycoplasma as part of that list as well. Your symptoms matter. Your cycles matter. Your season matters. So if you have something going on with you, start writing down things on the calendar. Oh, a month ago, I had this same couple of days where I had this migraine headache. I had this go on. And try to add all the other things that might be around it. Remember, these are multi-system problems. What you have to do, partly because your doctor won't be as good at it, is you need to be your own detective. And the more information you can give them, they say, oh, maybe that doesn't matter at all. Or someone will say, that makes me think of something. Maybe we should check this. If that person doesn't do that, maybe you need to talk to another doctor. Because part of these things are hidden in our population. And to be honest, we were finding, I worked with Eric Gordon's office and down in Occidental, which is very similar to here. And I came up here to the Lost Coast, and I got bit by ticks, and I thought, holy shit, okay, I don't want Lyme. And I had spent all my time in Maine asking everybody about Lyme, because they said, oh, no, Lyme's not on the West Coast at all. We don't have Lyme there. No, you don't need to know about that. This is not a big deal. Maine had a lot of Lyme. The East Coast had a lot of Lyme. But Wayne Anderson and I were there at night. And he kept going, Terry, there's this weird thing. There's these people that are really, really sick and been sick for a long time. I think they have Lyme. And if you know Wayne Anderson, he's a PA, a naturopath. He actually was correct. And so we ended up starting, there was a study group in Sonoma County that I was in, and we started looking at all these cases and looking at the testing and everything else, and a large percentage of them had Lyme. And that was part of the issue, and they were really sick. They weren't getting well. They were sick all the time now, and frustrated because nobody believed them that it could be anything like that. Climate shifts, outdoor exposure, wildfire, smoke. I'm going to use one more environmental one. I have a really good friend who's the Bishop of Spokane. I'm Episcopal, and so she's the bishop. She married me. Good friend of mine. And she started having this lung problems, and I said, okay, this seems kind of weird. She was a chemist, which, of course, hoods, no masks, being a chemist, a PhD chemist in a school. But then she decided to do MDiv school in New York, and she was a firefighter at 9/11. Her lungs were trashed. 2 months ago, she got a bilateral lung transplant. And I kept saying, Gretchen, I think this is from 9/11. Oh no, they say that can't be it. It's not really being helped with steroids. I think this is 9/11. And they finally admitted, just as they were going into the OR with her bilateral lung transplant, that it was because nobody had masks and there was so much shit in the air. She had fibrosis of her lungs to the level that she needed. And you don't just do one lung, you only do two. So she just had a bilateral lung transplant. one of the complaints in, what's his name that does those movies, was he was commenting about how in Cuba, speaking Cuban, yeah, Michael Moore made a comment that we were not even helping the people from 9/11, and they were trying to go down half of them to Cuba so that they could get inhalers. Inhalers are incredibly expensive, and they keep making the prices go up. But their lungs were so trashed from that process. They needed inhalers after all of the filtration, and nobody had masks or anything else. There wasn't enough of anything, and they were digging around all of that rubble trying to find people frantically. Sleep problems are worse, environmental exposure, worsen all the symptoms. There can be a dominant phase that you need to look for. The symptoms can overlap. Some tests have very lacking in accuracy. That was one of the issues with Lyme and all the co-infections. The tests aren't that good. There's a couple now that are a little bit better, but they'd say, oh, everything was negative, so you do not have Lyme. You do not have Babesia. You do not have Bartonella. You do not have any of these things. And that was not true. There was a guy who was an oncologist in Baltimore, and he was a marathon runner and a doc. And he suddenly couldn't run his marathons anymore. And he kept going, there's something wrong with my heart, something wrong with my heart. They looked at his heart and they go, whoa, there's really something wrong with your heart. And he ended up having a heart transplant, but he kept saying, I think this is Lyme. He was an outdoorsist and a marathoner, and Lyme damages your heart. I've had people that say, oh, I have Lyme. They go to a cardiologist. They go, oh, no, that's not what it's from. I treat them for their Lyme, and their heart failure and their heart normalizes. That doesn't just happen. It doesn't just happen. I mean, this is lots of cases. So be aware, there are a lot of things. Yes, do we sometimes have heart attacks? Yes. Do we have, valvular leakage? Yes, we have all of those things. And yes, we need to get those diagnoses because they're going to want to use a whole bunch of meds to stabilize all of that. But sometimes you need to have somebody who also look outside the box in that process. Appointments are short and far behind. I was working at a clinic, I won't say their name, and we had a parting of the ways, and they said, well, why are you upset? And I said, I can't diagnose something if I have 7 minutes. I'm sorry. I'm an internist, and I'm getting all the sick people that nobody else can diagnose them in this clinic. And you're saying that I have to see them for 7 minutes. Appointments are getting farther between. They're also going tele. That's not a bad thing. It's got some bad things, but also not some good things too. But most of my medical students were coming out and saying, oh, the physical exam really isn't that important. I'll just do everything by tele. We'll work on it. And I was one of the first tele doctors in Willits at Howard with Jim Good, covering the ICU and the hospital, and admitting people at night by a robot. Before it became popular with COVID, this was like 5-7 years before COVID. They were giving $12.50 to do that. Now a televisit is the same exact money as a regular visit for the system. So they're trying to do a lot of things by tele, and we don't have enough doctors here. So yes, if you need a therapist now, some of the best therapists around are tele-therapists. They have 30 years experience, but they just don't want to go to an office anymore. So think about it. It is an access to getting into something, or even a doctor who knows about Lyme and mold, and ask them if they know about Lyme and mold or any of the kind of unusual disease processes. Illnesses can hide and reactivate things: surgery, trauma, anesthesia, dental procedures. Literate doctors are frustrated, so oftentimes they make their practices into cash practices because they don't want to deal with the bullshit anymore about being asked why they get all of these labs and they overuse, but they figure out the people that really have these things and then they treat them. So it's hard because if you don't have money and you've got partnership or you don't have anything, these things are expensive. These things are expensive. Ticks now survive in warmer winters. They don't go away. The season is longer. Animals spread ticks as well as bugs now spread ticks. There's new species appearing everywhere. ILADS has every area in the world has a different, same family, but a different species, and some of the tests don't cross-cover. So if you get a test through Quest, you'll usually have 2 species checked. If you have a test with iLabs, there's usually anywhere from 123 or above species checked. That's why it's a Lyme literate lab. Is it expensive? Yes. Can you get it covered, some of the things with Medicare? Yes. Does it cover partnership? No. So there's a whole bunch of different stuff going on like that. It's kind of like even Ozempic. They just dropped Ozempic off partnership lists. So things are changing. There's more storms causing leaks, older homes holding moisture, hidden mold grows silently. It can affect breathing. And we're even finding now that genetics, you can actually have genetics that make you more sensitive to mold. And so let's say you're in a partnership, you're in the building, they're in the building, and you can't breathe anymore. And the other one goes, you know, that mold's not a big deal, dear. You know, I washed it down with my towels and my ammonia and all of this sort of stuff. I had a couple who, their house was so full of mold they had to move out of it. He was trying to clean it frantically with no respirator. He got asthma from the mold, from aspergillus, but he got dementia from the mold. But he didn't have the gene. The wife was much more sensitive to all of it, so she got treatment, she went through it, she made him move out of the house, all of those things. But because she had the sensitive gene for mold, she was able to tell. Even a lot of times people walk in the door and go, oh, there's mold here. They walk out the door when they're trying to look at houses. There's a lot of times, there was a guy named Shoemaker who did most of the trials initially. He's not my favorite, but I'll tell you about him anyway. He was in Baltimore or Maryland, and they had an algae outbreak. Where else do we get algae outbreaks? The lake, Lakeport, algae. Why do you think they check your boats anymore, or when you go out on the lake and all of those things? It's fairly similar to the algae they had in the Baltimore, Maryland. They had out-of-control headaches, diarrhea, all of this, and he was a lab guy before he was a family practice doc. He goes, this is really weird. I've got this group of people that have all these symptoms, and he checked their HLA-DQ, and they were all identical. It's like what you look for scleroderma, rheumatoid arthritis, any of the autoimmune disease. And he said, that's really weird. I've got all these people in this practice that I can't figure out what they are. So he checked everyone in his whole practice. And he made a Rosetta Stone. Everybody know what a Rosetta Stone is? In Egypt, when Napoleon was moving in, he wanted a road. So he put all these people on making the road from Egypt up to France. And there was a smart worker, a slave, of course, who picked up some papers and looked at it and he goes, there's writing on this. They pieced it all together and it had 3 ancient languages they'd never been able to translate, all written down with the same exact phrase. So they were able to crack the languages for that area of these ancient languages. He made a Rosetta Stone of his patients and found that some people are sensitive to everything. They get their genes from their family. Their whole body gets disrupted. They get SIADH, which is a thing where you can't stop peeing. It's like even though you haven't been drinking at all, you can't stop peeing. It's like diabetes, which pulls all the water out of your cells. SIADH is an endocrine disease that also happens when you have cancer of the lung. But there is some antidiuretic hormone that you can actually treat them so they'll hold on to their fluids. But it's triggered by mold. So it's important to check for mold in your house. It's important to bring up mold if you have mold in your trailer, if you have it in your basement, if you have it wherever it is. The Shoemaker book is not very good, personally. I'll just put it out there. And I definitely wouldn't call his office. He does have trained people. They're really good. He's kind of, never mind. I won't use that word. But there was one of our local guys from Fort Bragg, Neil Nathan, wrote a great book called Toxic. And Toxic is really easy to read. He's in his 2nd edition, and he's an expert talking about how this stuff reacts in your whole body. So if you have any questions or anything like that and want to know more about mold, pick up Toxic. I think it's also in Audible or one of those other ones so that you can actually listen to it in the car. Symptoms mimic infections. They weaken immune system. They can cause sugar cravings because mold lives on sugar. They increase leptin, which causes hypothalamus issues and causes obesity. So some people who try to lose weight, even with Ozempic and everything else, and can't, sometimes they have mold because they can't get rid of it. And actually, Shoemaker's first book was about obesity and how it was all due to mold. Didn't get very much reviewed. Nobody really talked about it, but leptins can affect blood sugars. Stress weakens defenses and immune system. Poor sleep causes increased inflammation. Oh, I don't like that machine. There's a lot of different options now, and you can get them home kits now to actually check for sleep apnea. With a lot of smartwatches, I had a guy say, it's kind of weird. I sleep 12 hours, but my watch says I only slept 4. It's because he does have sleeping issues, and his watch is picking it up with the smartwatches. So if you think that's an issue, or you snore, or you have a lot of issues with sleeping, it's a good idea to just get it checked. You can do it at home now. Again, they did it 20 years ago, and now they're doing it again at home, which is kind of nice. Bodies that become really sensitive start getting skin outbreaks, psoriasis. Skin is an excreting organ of our body. We have mold. Could we get psoriasis? Of course. But the way our society treats it now is we use biologics which turn our immune system off. Different focus. Infections, environmental stress, all fits together, multiple causes, multiple symptoms that fluctuate. Healing takes time, though. Even if you find out you have one of those, you need to find somebody who knows what they're doing in terms of helping you get rid of this. Often you must get out of your environment. You know what some of the biggest issue is? Somebody goes, well, I can't throw away all my clothes on my couch. That's where mold hangs out. In your clothes and your couch. In your closet. In your bathroom. Yes, those are your sacred things. But, I don't know. Do you want to have more and worse mold? It's kind of a hard decision, but I'm going to show you a sheet of somebody else that I've taken the name off and pass it around, and it shows all the different things that all of these mold can cause. You can have it from childhood to present age. You need to look at the patterns. You need to clearing and getting things out of your body for your health. Oftentimes what we do is we recommend binders, because what they do is they make your body not recycle. Your body is very self-sufficient in keeping everything in and holding onto it and reusing it. But if it's mold, you don't want it then if you reuse it. We're now seeing with AI MRIs and CTs and chest x-rays and abdominal x-rays, they go in and think it's a tumor and it's mycelium. It's mold. You can actually take any of your old CTs and MRIs and we can put it through a process with AI, and they'll show exactly what color it is, what exact mold it is. So be aware, it doesn't just hang out. It doesn't just cause things in one area. It's not just that yeast infection that you keep getting and can't get rid of. Okay? Especially if you can't get rid of it. You can get the infection. So what is Lyme disease? Infection from tick bites. They can be tiny or normal size. Symptoms can vary. Effects on any organs. Early treatment always makes a difference. They did a head-to-head study, 22, and actually Doxy still left Lyme even if no matter how much dose they did, even though they've gone to 21 days. But they did it against herbs, and herbs actually work better. And if you're interested in those things, I can show you. So even in the early stages, the guy who's the most well-known probably for the herbal treatment is Junior. And his books are very complex, but they're amazing. He's no longer with us. But he has one on Lyme and all the co-infections that I would recommend. And I have it in the medical library at my house. So fatigue, common symptoms of Lyme, fatigue, exhaustion, migrating joint pain, muscle pain, because it likes the collagen, brain fog, memory issues, headaches, dizziness, POTS where you start falling down, moving multiple systems and symptoms, and sometimes it can go dormant and then come back, can cause long-term disability. Tests often miss the cases. There's no rash in a lot of them. Bites go unnoticed, symptoms mimic other things. And it's a really long-term disease, and there is a guy in New York, I believe, Horowitz, who's now using TB drugs called the double dapsone to treat Lyme. And those are what we use for TB. And he's getting people cured. You can get cured earlier than that, though. So, but a lot of it's when you jump on it and when you figure out what it is. Tick season is longer, earlier spring, so higher activity. Goes all the way into the fall. The warm winters make it harder. High exposure. It affects all outdoor workers. They can carry multiple things, so you can have anywhere from 3 to 5 to 7 different infections from one tick. But basically, it causes the sweats, the shortness of breath, affects the nerves, the gut, and emotions. Harder to diagnose. There's more severe symptoms. We used to not think it kept going on and on like Lyme, and it does. So we're having to treat right now more aggressively. Bullseye rash is not always present. If it looks like a bug bite, then go ahead and treat yourself with either herbs or doxy, which is the most common. Minocycline is even better, but they usually won't give that to you. And the ears are only giving you 2 days. That's it. They're giving you 2 doses of doxy. That's all they'll give you. So unless you go to a Lyme literate doctor, they'll say, oh, that's probably enough. Probably not. Usually you have to get the whole tick, and if you do get the tick out, if you put an oil on the tick, or sometimes they used to hold up a match next to them and they'd pull themselves out. If you can get the whole tick, if you send it into vector control here, Lakeport or Sonoma County or Mendo, they'll actually run the tick and see if it's got at least Lyme. They don't promise they'll check all the other ones, but at least they'll check it for Lyme. Good. Yeah, it's really worth it, because if you can get it at the beginning, and then you don't have to take it, all those antibiotics or those herbs either. It may look like a bug bite, but it also can be fleas. We often find they come in with cats. We find it comes in with dogs. It comes in with horses. I had one equestrian kid in high school, and I had just given a lecture at Palm Drive, and one of the doctors goes, oh, maybe I should just check for Lyme. You know, I don't think it is that, blah, 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 blah. She was a horsewoman, competitive, suddenly just felt horrible. She had encephalitis Lyme. So she had to be in the hospital for 21 days with IV antibiotics. But she was running horses. Ticks like horses too. Sometimes there's no rash. Can be in hidden areas. They like to go under your arms, in all those places you can't see, in the middle of your back. So sometimes having somebody check you is helpful. Don't rely on the rashes. Migrating pain, new brain fog, fatigue after outdoors, worsening without reason, seasonal flares or patterns, especially if around menstrual cycle. It messes up your hormones really bad. So suddenly your hormones may go wacky, and you may not have, endometriosis, or you might not have all of those other things that usually what they diagnose. So at least put it on the list.
Has there been anything found of it being transmitted from animals who have many ticks and then lick you?
Yeah. Well, it's on their body.
Yeah.
It's not transmitted through their tongue necessarily, they didn't believe, but they felt like it was. Ticks tend to jump bodies, in a circle of friends. So I believe they didn't show it. They actually started doing Lyme testing more on the East Coast really early on. And a lot of states, not California, have a yearly Lyme test, because it can also cause heartworm, heart degradation in animals too. So, and cancers and other things too. Mold is in hidden damp areas, behind walls, affects your energy, causes brain fog, often goes unnoticed, musty smell, water stains, feeling pain, condensation, visible spots, causes inflammation, impacts sleep, affects memory and mood, worsens allergies, may cause fatigue. It happens more in stormy areas, flooding areas, higher humidity areas, leaking over homes, and specifically mostly in the rainy time, but it can continue on through the other time, because it's not that the water also goes away and then it's not spilling things. And if you try to clean it up yourself, what happens when you put ammonia on mold? It releases spores.
Really?
Yeah. So you need to wear a non-rebreather. You need to wear something or have somebody else do it. Clean it up, but make sure they have good respiratory masks and all this. So a lot of our guys that are construction guys that tear out all that stuff that you don't want to tear out, they come back and they have mold. And I've got a lot of them, actually. So fix the leaks, increase the airflow, use fans, clean all of your hydration or your filter stuff. Anything with mold, always use a mask. Keeps things dry with low humidity. If you have to, just get somebody else to clean it for you. Wear a respirator is what I recommend. And thyroid also controls metabolism. Low levels cause fatigue, weight changes. All of these can cause weight changes. Cold and hot sensations, depending if it's high or low. If you have autoantibodies, it often overlaps with those, as well as viral infections. Stress is affected by thyroid and cortisol and blood sugar and weight. It affects sleep, weakens immunity, raises inflammation, worsens symptoms. Affects every place in your body. It affects your hormones. Mold affects immunity to cancer. Stress slows healing. All of them affect sleep and inflammation. One of the biggest complaints in our society is that we can't sleep. Some of that's because we're on overdrive with sympathetic and not parasympathetic and calming things down. Or politics. Don't. Infections affect blood fog, fatigue, and pain, and all of these are connected. So, if you've had symptoms for months, if you have unexplained fatigue, worsening pain, brain fog, no improvement, have skin rashes, you just come in, make sure you look for everything, trim your grass, wear long sleeves, wear repellent, turn them into the county if you need to, bring the symptom list to your doctor with a timeline and questions and medications and exposure history, and you deserve to be acknowledged that your symptoms are real. Diagnosis takes time. So keep asking, talk to your friends, talk to your doctor. If you can't talk to your doctor, maybe that's not the right doctor for you. Small steps are really important. Healing is gradual. You need a lot of support. Understand, and as a community, we can kind of bring these diseases under control if we keep sharing them with each other. There are a lot of different websites and organizations. Some of them will actually even pay for testing if you can't afford testing, that are Lyme support groups. And sometimes they'll even do it after you've already done the testing. So they're like a scholarship for the testing, even though, like I said, the testing isn't always as good. There's just a couple that are a little bit better. They have the LymeDisease.org, which you can get online very easily. It's got a whole lot of information about Lyme, specifically and all the co-infections and all that. Do not go to the US Lyme website. It's not real. It's not really about Lyme. If you really want to know about Lyme, you go to ILADS, the International Lyme Disease site. And that's where all of the good doctors who are really treating Lyme and sometimes even mold and all the co-infections are trained under, is usually ILADS. And they have international scientific meetings, and they're coming up with new stuff all the time on how we can try to make this an easier thing to fight. Questions?
What herbs are you referring to for Lyme?
There's a whole bunch of them. Some of them are not native to us. I actually have a handout that I think I have here in the car. I'll bring it up, but it has both vector control of Lakeport and us on it, and it's got the list of the lines. What they did on the study, and I have the person who's kind of been the big person pushing things with mold is Jill Krista, who's a naturopath, who's not practicing anymore, but mast cell 360, it can cause mast cell activation syndrome and histamine responses, is all full of stuff on mold. And there's actually a mold questionnaire, which I have that as well if you want to try and take that today. And I'll get that list so that you can actually have a copy. Because there's probably, and the article shows that there's 2 to 3 that work both if they're active and non-active. And then there's some that work right away if they have a tick bite, and then some of them don't. that are not as good, but overall would give some. Good question.
How do you feel about bright therapy?
About Rife therapy?
Bright therapy.
I've never seen somebody cured with it, but usually those people don't test for it, and they're doing it on their own, and I've seen it actually make people feel a lot better. But I don't have good enough statistics of, the whole process, checking to see if they did get tested, were they positive, were they not, following their symptoms, all of those other things. But I know a lot of people do them and get their own Rife machines, and they control their symptoms with that. What we call with Lyme and mold is Herxheimer reactions, and even if you just do binders. Anybody know what a binder is? What's a binder?
It takes it out of the body, makes it excrete.
So it makes it non-recoverable from your body trying to hold on to it. So charcoal is a binder. Bentonite clay is a binder. Chlorella is a binder. Cholestyramine is a bile salt resin. It's a binder. And we found actually that certain molds and certain things come out better with certain different binders. But even if you're having a big herxing cycle, you can start the binders and actually control things. Doing a sauna brings things out. In that hot tub,
Cilantro pulling out heavy metals from the body.
it can do that too, yes. The binders pull out things. That's part of what they do. They make your body not recycle in this process. But I have a list of binders and how each of the molds get decomposed through what different stages. If you're interested, but it's pretty scientific. But binders really are something that you should have around. And so if you start feeling bad or getting a flu or a cold or whatever, pick some binders. They did a study out of Berkeley, which they did just on major drugs, general drugs. And they had the main cold, and they gave aspirin, ibuprofen, and Tylenol. And actually they found that, and they did viral loads of the people in the study. It was through the wellness group at Berkeley. And actually ibuprofen actually killed or decreased the viruses faster. So just FYI.
Which one?
Ibuprofen, Motrin. So they can be useful, so don't ignore them, but be aware there's other things that are similar to that are also herbal that you can use as well. And if you have any questions when the herbal clinic comes around with their trailer, ask them. Tell them what you're having. They'll give you the right herbs. They'll give them to you for free. So we have a really active herbal trailer clinic that is going around to all the different towns and spending times by the clinics, giving away free herbs, giving away free education, and they're all really exceptional. I should know, I'm on board. So yeah. I mean, I don't go around. I don't have time to go around, but yeah, they're really great and can give you some great options. And oftentimes, if you grow your own herbs, then you use them more. So we are giving away herbs and plants, kind of in the midst of this time of food deprivation and everything else. So if there's something people want, let us know. There's the herbal garden at the Grange that was put in as well. We always have little starter things that they'll often give you, or seeds. The library seed library is all around. It's got a lot of herbs in it as well. It depends on how, do you need to have a plant in front of you, or do you want to grow your own and have a patch in your own yard? Yes?
How about like French green clay as well as the
Green clay's good.
bentonite?
Yeah, that's a good combo.
It's all right.
It doesn't take out ochre toxin very well, but it does take out most everything else.
Okay.
Yeah. Diatomaceous earth, stuff that you put in pools. Yeah, these are all binders.
I'm suspecting, and have been for years, that sugar is a real one that triggers for me intensely. But I have to be careful, because if I back off too fast, then the toxins in the body drive me. I get really sick.
Well, and if you lose weight, people go, well, why am I losing my hair? Okay, you can go get the Nutrifoil stuff for your hair, but you put toxins in all sorts of places, like in your fat. You put it in your hair. When you stop something, oftentimes those things leach out, and yes, that affects your hair, that affects your hormones, that affects all of those things. Whereas if you take binders, it pulls them out. So, and it's not always just sugar. It oftentimes also depends on the type of sugar. honey? Is it artificial sugars? Is it, you know, is it sugar cane sugar? Some people are really sensitive to that. And don't forget, fruit has sugar in it. It's a little easier on people's body, but it does bring up the blood sugar. So they even have monitors they can put in your arm, and you can actually do an app on your phone and see exactly what your blood sugar is at that moment after you eat fruit. They're ready to go, and you can tell. But with Ozempic, the other thing we're seeing is that people aren't eating. It makes you nauseated, sometimes vomiting. They're trying to lose weight. They sometimes forget to eat in the midst of it. We're having a lot of dizzy spells, all of that sort of stuff. It pulls all that stuff out of the fat. Most of them are not doing any kind of binders as well. They are losing their hair, and they're losing their muscle mass too. So you can regenerate the GLP-1s by yourself, and if you stop Ozempic or any of the GLP-1s, they say, oh, you have to be on this for life. What it does is turn your GLP-1s off. So just like turning your pancreatic enzymes, you have to reawaken them up. And unless you have pancreatitis, you should reawaken them up. You should start taking things, bitters. Most of Europe takes bitters of all different kinds. They do them before meals, and it gets your stomach and everything to wake up just before you eat. It helps you digest. It helps you do all of those things. So just be aware that it's a panacea. It's not always the perfect thing for everybody, and it's being kind of defunded a little bit right now too. So a lot of people are suddenly not on those medicines. So you might encourage them to find other alternatives to turn things on. Yeah.
Question for a community member that's not able to make it today. Just this person is kind of like how you're describing, like they've tried many different doctors and things like in Santa Rosa and some other places, and they're kind of just like at their wits' end with trying to like get like certain blood work or urine samples, because this person has made lifestyle changes, like, you know, getting like a lot of plastics out of their house, not cooking with that, going back to like taking out all the processed foods and all this, and was like on GLP-1s, but has been now denied because of insurance for like the past couple of months. But in the past, over 6 to 12 months, has seen big improvements in terms of weight and all of this, but due to maybe environmental things or this body composition changes, this person wants to know, like, where did they even start, or a point of contact to even like go down the avenue?
Like a doctor, or like things to do even at home? I mean, organic food,
I just think because like
non-pesticides,
yeah,
eating things that aren't pre-processed. That's where all of this stuff
I think
is.
more of
Filtration systems on the water.
more of the fact is like on the diagnosis of like the blood paneling and stuff. How you're talking about like some doctors are not going to order a paneling because they just who do they contact and say like, okay, kind of like the eye was called.
So just so you know,
Yeah.
this is a little plug for tribals and all of the partnership clinics. They often have free prices even if you don't have any insurance, and they are cheaper than any place you're going to get it. And oftentimes they have walk-in policies, and you can just walk in. You mostly need to be from the area where you're going, but they'll put you on a cash plan, and if you run them by yourself, they're very, very expensive, and sadly Adventist is one of the highest. So with that, you want some lab work or something immediate, and that sort of stuff. It's way cheaper than the ER, and especially if you don't have any money or any insurance. So connect with your local clinics. The tribal clinics all have tribal clinics, and you don't have to be tribal to be a member. And they have providers, and they'll do the lab tests and all of those kind of things too. And it's better sometimes if you have a continuity with a person who watches you go through those, and then if something comes back, they can explain what it is and then put you on the right program too. That's not what an ER is about. If you're getting ready to die, you need to go to an ER. If you're getting ready to have a stroke, you need to go to the ER. If you need something catastrophic and you're bleeding to death, you need to go to an ER. But oftentimes people are using an ER as a primary care clinic, and that has really messed up our hospital systems even more. And if the person's not perfect, deal with what you can from them, and then there's other persons out there that you can find that can expand the list of things to do, can talk about this. A lot of them, the clinics have nutritionists, where a single office does not. They're supposed to have social workers, some of them do, some of them don't, but they have dental care. as cheap as you're going to get it, unless you're going to go to Mexico or some other country. So with that, try to take advantage of these places because on the whole, they're a good baseline of covering them things. Can I tell you they're all going to know about Lyme and mold? I've lectured many times at Lakeport Tribal, and if they get a mold or Lyme, you know what they do? They don't order the labs. They send them to me. And I was trying to get them so that they could do this. It's not really working very well. So in the midst of that process, get at least the baseline taken care of. And they have stats on what they do. Yes, they'll ask you every single time if you want a vaccine, and you just say no if you don't want a vaccine. But they do good healthcare maintenance. They do check you for colon cancer. They check you for mammograms, in a crude time. They check you for all of the different things, and they ask you questions that will lead to some basically good care. They may not be able to diagnose you with mold or Lyme because they don't know anything about it, but they will be able to take care of some of the hot spots and at least deal with that. So get continuity with someone wherever you can.
I just want to go back just a little bit. I'm hoping that you said that when we have the waist or the muscle, we're losing muscle, that it is replaceable.
Yeah, but you have to start doing exercise.
Well, yeah, I mean, live life.
Well, but even walking, or even the newest thing is getting up after dinner and dancing. It gives your heart joy. It's like one of the most, instead of listening to the news, and if you're by yourself, do it by yourself. Put on your favorite tunes for whatever time you like. If you have somebody else in the house, make them dance by themselves. This is not like junior high, okay? You can be together or not together, or you can be just two people dancing.
So you're saying you can replace?
You can replace it, but you have to work at it, because it really does make muscle waste.
Yeah.
How about helping it with creatine?
Be careful with creatine. What a lot of people are doing, especially the weightlifters, is they're overdoing the creatine and they're whacking their kidneys and going into renal failure. So you got to be careful. I mean, if you're going to take a little bit for a very short period of time, okay, you can get it at grocery outlet. I mean, I'm not kidding. But if you're really, really honest about, figure out something you can do. Oh, get a stationary bike that you have in your house. Get a little trampoline, a mini tramp that you can actually just walk around in your house even if it's raining. Get a 3-wheel bike. You start doing more general exercise as your goal. Put it in your life.
I have an e-bike and it's helping me because I can't do the push on it
Right.
on our hills and stuff. And it's really been a lifesaver
Yep.
for exercise.
Sorry to see you, but we're here for her because she has all of the symptoms that you have discussed, like extremely high. They ruled out Lyme's for her, said she has MECFS. But is there anybody in this county
So
to
MC,
see for that?
it's kind of a trash bag term that they used to put fibromyalgia and
Yeah.
multiple
That-
chemical
but she has, like,
sensitivity,
all
blah, blah, blah.
of those symptoms.
Go to Mastell 360 and start, and actually that questionnaire,
Yeah.
if you have it positive, there's other ways you can figure out if you have Lyme, but it usually takes somebody who knows Lyme to help.
Because they
in
did
the
like
process.
just this 8 lines, whatever they do here in Venice.
A very
They go, oh, you don't have Lyme, so let's put the testing. So like,
Just because you're going tested negative doesn't mean you don't have Lyme.
that's what I'm like.
But check mold and Lyme. And I have a mold questionnaire that Joe Krista is patenting, so we're now in the stage of seeing how does it rule people that don't have mold out. But it's on Mastell 360. And so there's a huge study group of international providers that I'm in that we meet once every 2 months, and we do cases. And it's with Neil Nathan and Joe Krista and people from all over the world who are working on this stuff.
For like provider to see, I mean, should she come out to Lake County?
Well, the one condition I told them when I went to Lake County is someone said they were my patient, even if they were in medicine, they had to see me. That's unusual, because usually they just see people in Lake County. I can't tell you get in quickly. I've just been out for 2 months, so everybody's kind of
a little nervous in the midst of it, but yeah.
Yeah.
Where else do you practice, Terry?
I had a private practice in Sebastopol that I've had for forever because I was chief of staff at the hospital there and ran the ICU, and I've done integrative medicine since I started right out of residency from Lyme. That's small, it's most really on Monday. I practice in Ukiah on Thursdays, and then on Tuesday and Wednesdays, I spend 2 10-hour days seeing people in Lakewood.
Okay, and where in Ukiah do you practice?
I'm on Dorian Mill where Anthony Morris used to be.
Oh, yeah, yeah,
I'm in his own practice.
private practice.
Yep.
Okay.
Are you overloaded?
You just have to call my friend Robin, if you know Robin Pilati. She's an old Willetonian. She's my office manager, and talk it over with her.
Where are you in Sebastopol?
I have been, I do a lot of different frequency stuff. So I used to be at Lens, which is a low frequency for brain damage and strokes and all that sort of stuff. Its headquarters is in Sebastopol with Len Oakes, who's no longer with us. But Daphne is running it now, and a lot of psychologists get that as a part of their training. I'm in with, I don't totally mutilate her name, Martha Grungreg, who's a golfer, and they're there on Mondays. And so we're in the old yellow building where Brian Bouch used to be. There was a church, I think, before then.
Well, you're at Hill Park?
I'm just behind Hill Park.
Okay.
Brian Bouch had Hill Park. Is this helpful?
Yes.
Okay.